Good evening po, Dr. Hector and classmates. We have a new topic tonight, which is anxiety. This is all about Western and Chinese medicine concepts. Anxiety is a normal reaction to stress. In general, it helps one to cope. But when anxiety becomes an excessive, irrational dread of everyday situations, it has become a disabling disorder. Okay? Anxiety in Western medicine is a dis I'm sorry, anxiety in Western medicine. The anxiety disorders discussed in Western medicine are as follows: generalized anxiety disorder, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social phobia or social anxiety disorder, and specific phobias. Each anxiety disorder has its own distinct features, but they are all bound together by the common theme of excessive, irrational fear, worry, and dread. A chronic state of anxiety is usually called generalized anxiety disorder. The essential characteristic of generalized anxiety disorder is an excessive, uncontrollable worry about everyday things. This constant worry affects daily functioning and can cause physical symptoms. Generalized anxiety disorder can occur with other anxiety disorders, depressive disorders, or substance abuse. Generalized anxiety disorder is often difficult to diagnose because it lacks some of the dramatic symptoms such as unprovoked panic attacks that are seen when with other anxiety disorders. For a diagnosis to be made, worry must be present more days than not for at least 6 months. Okay? Physical symptoms may include muscle tension, sweating, nausea, cold clammy hands, difficulty in swallowing, jumpiness, gastrointestinal discomfort or diarrhea, irritability, feeling on edge, tiredness, and insomnia. A panic attack is defined as the abrupt onset of an episode of intense fear or discomfort, which peaks on approximately 10 minutes and includes at least 4 of the following symptoms: a feeling of imminent danger or doom, the need to escape, palpitations, sweating, trembling, shortness of breath or a smothering feeling, a feeling of choking, chest pain or discomfort, nausea or abdominal discomfort, dizziness or lightheadedness, a sense of things being unreal, depersonalization, the fear of losing control or going crazy, a fear of dying, tingling sensations, and chills or hot flashes. Panic disorder is diagnosed when individual suffers at least 2 unexpected panic attacks followed by at least 1 month of concern over having another attack. Sufferers are also prone to situationally predisposed attacks. The frequency varies from person to person. An individual might suffer from repeated attacks for weeks, while another will have short bursts of very severe attacks. Okay? Panic disorder affects about 2.4 million adult Americans and is twice as common in women as in men. Now let's go to anxiety in Chinese medicine. Anxiety is a modern term that does not have an exact equivalent in Chinese medicine. The author discussed the view of anxiety in Chinese medicine according to the following topics. Chinese medicine entities corresponding to anxiety. Second, rebellious qi of the penetrating vessel. Then the third, palpitations in Chinese diagnosis. And the last one is difference between mind unsettled and mind obstructed in anxiety. Okay. Chinese disease entities corresponding to anxiety. There is no Chinese medicine term that corresponds exactly to what we call anxiety, but several ancient Chinese disease entities closely resemble anxiety. The two main disease entities that correspond to anxiety are 1. Fear and palpitations or Jingji. Second, panic throbbing or Zeng Chong. Both these conditions involve a state of fear, worry, and anxiety. The first with palpitations and the second with a throbbing sensation in the chest, okay, and below the umbilicus. Fear and palpitations is usually caused by external events such as fright and shock, and it comes and goes. It is more frequently of a full nature. Panic throbbing is not caused by external events and it is continuous. This condition is usually of an empty nature and is more serious than the first. In chronic cases, fear and palpitations may turn into panic throbbing. In severe cases, panic throbbing may correspond to panic attacks. Despite the name fear and palpitations, such states of fear and anxiety may occur without palpitations. Okay? Now, in both fear and palpitations and panic throbbing, there is blood deficiency. Fear and palpitations come in bouts. Panic throbbing is constant. Panic throbbing is due to worry and pensiveness agitating within, causing a deficiency in phlegm heat. Okay? In panic throbbing, the heart is shaking in the chest. The patient feels fear and anxiety. There is yin deficiency and exhaustion. There is yin deficiency below, so that the gathering qi or zong qi has no root, and qi cannot return to its origin. For this reason, there is shaking or shrugging of the chest above and also shrugging of the sides of the umbilicus. Okay? Now let's go to the summary of Chinese disease entities corresponding to anxiety. First one is fear and palpitations or Jingqi. Second is panic throbbing or Zeng Chong. And the third one is rebellious qi of the penetrating vessel or Li Qi.